Hi, this is Carrie Schutte, the Public Information Officer for Shasta County Incident Command regarding the COVID-19 incident. Thank you for joining us on this kind of late notice briefing. We had some important information that we wanted to share with everyone. And I will turn it over now to our health officer, Dr. Karen Lanstrom.
Good morning, everybody. Thank you for joining us on short notice. So I think, as we're all aware, Shasta County has greatly benefited from the statewide stay-at-home order. And we were, because of that, able to keep our case counts low and our hospitalizations low. And our community's commitment to adhering to that statewide order really paid off. We're at a new beginning now. The governor announced last week a movement of the state into stage 2. Today, we wanted to let all of you know that we followed the state guidance to submit our attestation that our county meets certain criteria and is ready to reopen some low-risk businesses. And after we submitted our documents over the weekend, we learned that the state approval process is going to be more involved than we originally understood, and they will be reviewing our documents and posting them online. And we don't know when that approval process will be finalized. We hope soon. I think this has caused confusion. It's been challenging for us as well, and so I can imagine difficult for the community to understand and to keep track of. And so that's why we wanted to have this press briefing today to be clear where we are. So like the rest of the state, we are in that soft opening of stage 2, which involves retail with curbside pickup or delivery and logistical supports to and supply chains for those retail businesses, including manufacturing. So now is the time, I think, for our low-risk businesses to ensure they're reviewing the guidance and ensuring that they are prepared. I know that many of them have come a long way already and are eager to begin that work. This is also a reminder that life is not back to normal. Our priority is to get people back to work and to keep vulnerable people safe at the same time. And so in order to do that, to ensure we're able to open up our economy and get our workforce and businesses back to work, it requires us to do things differently. So a couple key things that are still in place. There continues to be no non-essential travel. We don't want the virus coming to our community, whether people from outside the county come here or we go elsewhere and come back. So really limiting travel to when it's absolutely necessary. And there's still no number of mass gatherings that is allowed. So at this point, we're able to be out and about to meet our own basic needs and to be with our household contacts, or if you're part of one of the original essential businesses, to be among those groups, but continuing to use physical distancing. This virus is still here, so even though the governor opened up stage 2 statewide, we still need to proceed carefully and wisely. So even as stage 2 does open up, when we receive the approval and we're fully open, hopefully soon, it requires all work environments to integrate modifications to open safely. That will integrate physical distancing, encourage use of cloth face coverings of staff and of customers. It'll require diligent use of personal hygiene and ensuring that the environments within facilities are cleaned regularly. So if you're a business owner, we encourage you to look at the industry standards and guidance for your type of business, and we have a lot of that information posted on our website at shastaready.org. If you look on the left-hand column, you'll see a link for Roadmap to Recovery, and you'll find a lot of useful information there. If you're a consumer, you can expect when you go into businesses that you'll see these modifications. And so you will look for, we encourage you to look for best practices, like, making sure that there's a limited number of individuals, that allows for physical distancing, and that cloth face coverings are being utilized by employees that are interacting with the public. And we have information on our website for consumers as well. I was out this weekend and I noticed, I think people had the impression that life was back to normal, and the couple places that I went, grocery shopping and such, I was the only one with a cloth face covering. And I think it's really important for all of us to know that now that we're opening up businesses and hoping to hear about all of stage 2 soon, now is the time where we are going to increase our risk, because we are going to be out and about and around others and are vulnerable to bringing that virus home to our loved ones who might have underlying health conditions or might be older adults. So it's particularly important for all of us to protect ourselves and our loved ones by using a cloth face covering and maintaining physical distancing when we're out and about. So as I mentioned earlier, allowing people to go back to work means that we have to forego some other life activities. I know we would all like to, get back to the way things were before, but we cannot be having large group gatherings and avoiding non-essential travel, as I mentioned. We understand that there's a real interest in the faith community to re-engage with their community, and completely understand that, and just ask you to hold tight for a while longer. Many in those groups, are your vulnerable individuals, and so please stay tuned to when the governor allows small group sizes to recommence. In the meantime, using your innovative strategies you've used for services would be appropriate. We don't want to backslide. Once we get approval from the state that we're able to fully implement stage 2, hopefully soon, as I said, we're going to see a bump in cases, I'm sure, and we want that to be at a slow simmer, not a full boil. We need to forego these mass gatherings and non-essential travel in order to allow our businesses, and in order to allow our child cares, and ultimately allow our schools to reconvene when that time is right. We all have a responsibility here, and we want our businesses to succeed, and so implementing the guidance is going to help them to protect their workforce and to protect us as consumers that frequent their businesses, and to protect our vulnerable groups when we go back and we interact with other individuals, whether it's in our workplace or at home. This isn't a one-way street, and a significant increases in case counts could force us to go backwards, and we do not want to do that. And so I am, I'm really hoping to engage the community and helping our businesses to move forward when we get the go-ahead and to do that successfully. Another really key component that I think it's important for everyone to understand is part of the attestation that we're doing to the state is that we have rigorous testing capacity and rigorous containment practices in place. So we've increased our capacity for doing disease investigation, isolation, and quarantine, because we know that as we're out and about more, even though we're going slow, we're going to see more cases. And the ability to open businesses relies on public health's ability to contain the cases that we see. So we identify a case, we isolate that individual, identify contacts, and quarantine them. So by doing that and ensuring we have the capacity to do that, because we have a low simmer and we don't have a full boil, that's how we're going to be able to be successful. If we have, disease spread among a large group of individuals who get together, that puts our community and our businesses at risk, and we do not want to go backwards. The other thing I wanted to mention too is that we do have the benefit of having a state testing site in Shasta County. Not all counties have that available yet, and so I would encourage employers to think about having their employees go there to get tested periodically, especially if they have regular contact with the public. That will provide your employees and yourselves and the public reassurance that your staff are safe. We also would recommend individuals who attended the rodeo this weekend that they consider going to get tested at the state testing site. There's information on shastaready.org about with the link of where you can go to get signed up. You know, we want our businesses to succeed, but this isn't something that our emergency operations center or public health can do alone. We all need to do our part. We all enjoy freedom that comes with opening businesses and restaurants, and that feels really, really good. And we look forward to a time when we can resume all of our activities like going to church or the school or to the gym. Those things will happen, you know, most quickly if we all do our part right now. And so I hope that's helpful to let everybody know where we are, and I'm happy to answer questions after we hear from Supervisor Rickert.
All right, thank you, Dr. Lanstrom. Supervisor Rickert, are you still with us? We'll need you to unmute first. Oh, there you go.
All right, very good. We with technical difficulties, I could never quite get my picture up online. But anyway, Dr. Lanstrom, I just want to thank you. You did an excellent job of basically giving us an overview of what's happening in Shasta County, and I appreciate all the work that you, Public Health, and the entire Unified Command Center has worked on. I do believe that our low numbers in Shasta County are a testament to your incredible talent and ability to get this pandemic under control for Shasta County and the residents. The residents have played a big part in this too. And I know it's difficult. I know people are anxious. The weather's changing and they're hoping to get out and get outside and enjoy their families and recreational activities. But we really have to, at this point in time, to continue in order to gracefully and carefully go through these stages. We have to be sure that we don't have any kind of outbreaks or little clusters develop, because that will basically set us back. So that's why we need to continue to ask the citizens of Shasta County to help cooperate with the county and with everyone to basically try and mitigate any potential for large gatherings if possible. So thank you for sharing that. And if anybody has any questions for me, I'll be happy to answer them. We were excited as a board on Friday night to basically approve the letter sent to the governor, and we're looking forward to really making some positive changes for our business community. Our business community is a big part of Shasta County's success, and so we want nothing more than to be able to facilitate that and to assist with whatever we can to make their transition as smooth and seamless as possible. So with that, does anyone have any questions, or I guess we'll take questions at the end?
Yeah, we were going to give Jake Mangus, the Executive Director of our Greater Reading Chamber of Commerce, an opportunity to share some words, and then we'll open up to questions.
Sure, Carrie and Mary and Dr. Lanstrom, appreciate the opportunity to represent the business community today. So I'm going to echo a lot of what you've already heard. We in the business community urge you as the community of business, as the community in general, to continue to toe the line in terms of following the state and local guidelines regarding COVID-19. You've heard about the importance of avoiding non-essential travel and mass gatherings. And from our perspective, that's because by doing so, we can continue to safely open more business types with the adaptations that are very well documented on the county's website. Because we have these protections in place, we are able to do so. The Chamber of Commerce is extremely concerned that ignoring these guidelines could set us back. And at this time, the last thing our business community needs is another setback. We don't want to certainly give the state any reason to be any more difficult on Shasta County than it would be on any other county in the state of California at this time. We've just got to do the right thing at this time. Fortunately, the manageable state of the health crisis in our community has allowed us to begin to alleviate the economic crisis that truly is far worse at this time in Shasta County. And we must work together as a community, all of us, to strengthen our economy, to get us back on our feet, and to continue to move forward and to make progress during this very difficult time. The Chamber of Commerce has really put its focus on business recovery at this time. So I just wanted to remind everyone that we do have a rapid recovery program, and that's divided into 2 phases primarily. The first phase is about connecting businesses to available capital. On the federal level, that's been a wonderful experience in working with our local banks, whether it's a national bank with a local presence or the community banks that we have, in connecting businesses with Paycheck Protection Program loans. A lot of success stories coming out of that right now, as well as the economic injury disaster loans of the SBA. Additionally, on the local level, we are pleased to work with Reading Electric Utility and the City of Reading on the rollout of the Economic Response Plan, which is nearly a $38 million local stimulus. Very fortunate to have a community-owned utility that we can draw upon for assistance at this time. And then finally, we are in the works right now in working with the City of Reading on the Community Development Block Grant funds to assist local businesses with even more aid at this time, which they desperately need. Phase 2 then will be focused on the long-term recovery efforts. We see this as being at least a 12-month effort for the Chamber. We're working with the Smart Business Resource Center, the Small Business Development Center, Shasta College's Business Training Center in partnership with the Reading Chamber University, as well as the California Endowment, which has come through with some support to make it all possible. So from our standpoint, again, at the Chamber, we just echo the sentiments of our health officials locally. We stand with them as together we have to move forward so that we can continue to open as many business types as quickly as possible in Shasta County.
Thank you very much, Jake. Much appreciated. Do we have anybody else who has anything to add before we open to media questions? Okay, we are ready for your questions if you have some.
Hello, I have a couple of questions for Dr. Ramstrom, one being the Cottonwood Rodeo, and what effect do you think that has had, if any, on our relationship with the state, on the county's relationship with the state?
Thank you, Mike, for the question. You know, I think the state is actually doing the best they can, and I've been so impressed with the state health department, with the California Department of Public Health and their leadership, who has taken extra steps to hear the concerns of locals and smaller communities, and including far northern California. And so things are moving fast, and following, you know, the governor's announcement early last week about this option to have a variance, they got guidance together very, very quickly and trying to have a process. And I think, you know, that presents some challenges. I think the governor's watching closely, and but I can't speak directly to how what they observe is happening here. In terms of like the rodeo, for example, how that's influencing their decision making.
Could you tell me what the status of the field medical station is in Reading?
It was determined last week that because our numbers are looking so good, that it seemed fiscally prudent for us to, in coordination with the state, in coordination with IMSA, to pack up our field medical station so that we could store it at a much lower cost than rent and other facility costs at the Civic. And so that's what happened. And in the interim, there has been a surge of cases in Southern California and Imperial County. And so we heard just first thing this morning that that they would like to use our ACES because it's available, and that would be backfilled with another set of supplies. And so we think that that's, you know, perfectly understandable and appropriate, and the state is trying to direct resources to where they're needed at the time, and we're happy to be able to help where they're having you know, quite some challenges down there in Imperial County.
And finally, could you clarify the regulations right now for restaurants? Can they open? Can't they? What are the guidelines for restaurants? We're getting a lot of people who seem to be confused about that.
Right. So right now, restaurants are open with takeout option and delivery. So those are the current parameters for restaurants. We know when we are approved, we have not yet been approved, but when we are approved to fully implement stage 2, that our understanding is that will involve restaurants with dining in. And so we expect that there's going to be state guidance from the California Department of Public Health that was developed in collaboration with the California Restaurant Association and the environmental health directors throughout the state and the health officers. And that should be available on the state website very soon for restaurants, so they can actually see specifically what would be required of them when we are able to move in full implementation of stage 2.
Thank you, Doctor.
Can you guys hear me?
Yes.
Okay. So, Dr. Ramstrom, obviously with what you were talking about with the experience you had over the weekend and the mass situation, people sort of losing their vigilance, maybe it sounds like. Is it, could you address at what point would you consider a mask, requirement, I guess?
Yeah, thank you for asking that. It's something, I think it's a tool we have in our toolbox. We are hoping that people voluntarily use face coverings because we feel like they're able to use their best judgment of when it's safe to do so and when they're in a situation where they don't feel like they can physically distance. But if we see numbers go up and we feel like that there is a lack of compliance, it's something that we could do. I am hopeful that individuals, as we move forward, will recognize that. So, it's that principle. My mask protects you and your mask protects me. And so we're using our cloth face coverings to protect people around us, and hope that others have the respect to do that for us as well, so that they help us to protect our loved ones that we go home to. And so we will continue to appeal to the public to, judicious, don't just use face coverings when you're out in public, when you're around other individuals, it can't hurt, and certainly there may be situations when they would not be recommended. That's why right now we really want to leave it to the individual's discretion, and hope that people develop that habit. We're gonna be in this position, in this situation for a while, and so you can develop the habit now, or you can develop it later. But at some point, you have to develop this habit because it's with us. It's with us for a while.
Hi, this is Ray here from Action News Now. Dr. Ramstrom, this is for you. I came across something that you mentioned in your press release last week, regional variance. Can you give me what a clear definition of what regional variance is exactly?
Sure, thank you. So the state is allowing counties that can meet certain criteria move forward more quickly through stage 2 than counties that don't meet that criteria. And so it's a long list of items. When it is final, it'll be available to the public. In fact, I think we actually have ours posted on our website. And it includes, like, what does our data look like? What do our case counts look like over the last 2 weeks? What do our death numbers look like over the last 2 weeks? Do we have testing capacity? Do we have containment capacity, meaning do we have enough case investigators and contact tracers to do disease investigation, isolation, and quarantine? Are our hospitals prepared to surge in the event that we were not able to contain spread? So those are the kinds of elements that are included, as well as ensuring that we have guidance available to our businesses so that they know what types of modifications they need to implement in order to open their businesses safely. So that's what the variance is. It's actually providing assurance and documentation of our rigorous planning that we've been doing over the last many weeks, and to the state that we are able to open up safely, and even though it will be in a measured and staged way.
So this is Anna Teray again. This time my question is for Supervisor Mary Rickert. So in terms, you guys endorsed the letter last week. What is your hope now for the county moving forward?
Are you still there?
Yes, hi, I'm still here.
Okay, there we go. My connection isn't very good. It keeps going out. Anyway, I'm really hoping that we could move as rapidly through stage 2 and into stage 3. And of course, that involves a lot of cooperation from all the citizens of Shasta County. It's really important that we get our business community alive and vibrant again. And so, but we also have to do it in a very methodical way and follow the guidelines and make sure that everyone is safe. I can't emphasize enough what Dr. Ramstrom says is in terms of practices such as face masks, that we need to respect each other's space, that we really encourage, that we think about, the person that we're next to in the grocery store line or whatever. We do need to be conscious of that at all times. So we're hoping that we can move into stage 3 as soon as we get through stage 2, but we need to get through stage 2 first.
Any other questions?
Hi, yeah, sorry, Anna here. Just some follow-up questions. Now, we were talking about the rodeo earlier. Are there going to be any repercussions for people who go against, the order set forth that's in phase 2, which is, no mass gatherings or no going to salons or anything? Are there any repercussions for people?
I would say that the repercussions would be felt community-wide. So if we have disease transmission, that impacts all of us. And so that's the major concern. And we'll have to wait and see what happens over the next 2 weeks. And if we have any cases that come out of that. I think the one thing that gives me some reassurance is that because we've been contained for a period of time that has allowed our case numbers to go very, very, very low, that I'm hoping that we didn't have anybody at that rodeo who was transmitting virus. And so we'll see.
To follow up to that, if, those people who did go to the rodeo get tested, could you see this setting Shasta County a step back? Like a delay into stage 3?
That's interesting. We've submitted our documents, and so I think that the state is going to they're going to review and just make sure everything's complete and post it online, is my understanding. Certainly for future decision making, it may be that the state will want another attestation of where we are at the time. When the governor makes additional changes later, I'm not sure how that will work.
Dr. Ramstrom, I've got a question for you then. In that, I'm still confused, sorry. There was a news release, I thought, Saturday that said under the regional variants that dine-in restaurants could open and the mall could open, but now I'm kind of hearing you say, no, that's not the case.
So we were under the understanding from the original instructions provided to us by the state, and based on a phone call with them on Friday afternoon, that our submission and then them acknowledging receipt of that was sufficient. And, I think, like I said earlier, the state is moving fast as well. And they're wanting to do their due diligence. And so they will be just making sure our documents are complete and posting them online. And then we will get the go ahead. So that is different than what we were acting on last week, all of last week, and until we heard that on later in the day on Saturday, I believe it was. So it's just kind of where we are. It's unfortunate that we're having to change things up a little bit, but I think it gives us more time for our businesses to prepare and to ensure we have good communication with the community, because I think because even between when the governor announced last week and the state guidance for this variance came out, and it was all very, very rushed, which did make it difficult to communicate to the community what is happening. And so now I'm hoping with this call today and then moving forward, maybe we'll have a little bit more clarity there, and you know, we'll be able to announce when we're able to fully open stage 2, hopefully soon, and hopefully it will be more clear what that means at that time.
Thank you for the clarification. And I know it's theoretical, but if another event came along that would have the similar amount of people as that rodeo, would the county more strongly discourage that? Would there be any change in how you would react to an event with a lot of people like that?
I think I'm going to defer to either Mary or to Mr. Pontes on that.
So, Mike,
Matt.
thanks for the question. This is Matt Pontes, CEO, Shasta County. Hey, I think that's a great question. That's definitely what happened out there in Cottonwood was not what we thought was going to happen. We thought there was going to be, you know, very, very few amount of folks out there that were guiding the guidelines of our social distancing, and it was going to be a very small event. And to your question, if we got wind of another event, anything like the size of that, even a lot smaller, we'd definitely be out there talking to folks. You know, one of the things, as you heard from our health officer and from our chairman of the board, is that we've really been working hard. As everybody's been working hard down here and across the community to make sure that we've been staying in place, and we've been, you know, practicing our safe distance with each other. And that's what's allowed us to get to this point. And having big events like that right now isn't going to get us where we can get the rest of our businesses open and get us back on track here in Shasta County. So I appreciate that it's springtime and everybody wants to get out. And I definitely wanted to get out this weekend as well. But when it comes down to it, those large events are something that we definitely need to wait on. So we're going to be, as we move forward, we're going to be out there trying to educate folks, try and make sure that we're following the governor's orders as we move through the next couple stages. And we're going to work really hard to work with the community to do as much education as possible. And with the hopes that the sooner we do some of that stuff and we stay on track with our number of cases, that we're going to be able to really open up Shasta County and the North State up here. And I think that we've got a good track record so far of getting everybody together and working with the business community and all of our communities and try and achieve that goal together. I know that if we have big events like that in the future, that's going to be a lot harder to get there. So that would be my message.
You are saying education. We're still not going to the enforcement piece?
So, Mike, enforcement is definitely one of the tools. I think everybody, whether it's the state offices of ABC or whether it's our sheriff, we do have those tools in the toolbox. We are trying to really focus on education. We know that we can do some enforcement, and we know that already in the North State there are a lot of folks out there that have had some violations from ABC across the counties. I'm not aware of any in Shasta County yet, but I know that that's right around the corner if we're not following the rules. So we are definitely trying to do as much education as possible and to really use that tool more than the enforcement tool.
Thank you, Matt.
Hi, Anna here. I just want to clarify. So, Dr. Lanstrom, if we do see more cases pop up in Shasta County in our area, could we see tighter restrictions tighten back up again? I just wanted to get a clarification on that.
Yes, we have part of what we included in our attestation for the variance to the state included a list of different data indicators that we will be monitoring closely. We're hoping to have some sort of a dashboard on our website that will be easy to understand for community members and for businesses and other organizations that might want to be able to, look and monitor that data to make decisions for the practices that they implement within their settings. And so my hope would be that we would be able to monitor those and see any identify early indicators that we might be having a problem, communicate that to the community, and encourage, more better adherence to prevention practices. And if it got out of control, then we would be at risk of having to back off some of the activities that we're hoping to implement very, very soon.
Other questions?
Yes, I had a question. What businesses are you looking to have their employees get tested? You had said businesses that have employees that come in contact with the public, but probably every business would come in contact with the public, or else their employees would come in contact with their colleagues. So what kind of businesses are you looking to get have their employees tested, and how will that be enforced?
So it's not so much a matter of enforcement. I think it's a resource and tool available to us. The state guidance for the state testing site is continuing to evolve, and we're monitoring it closely. It is originally was focused on critical infrastructure workers because those entities have been working even during the stay-at-home order. And so getting into the habit of having those entities test periodically makes sense. Including other higher risk types of workforce, such as healthcare workers, individuals who work in congregate settings. Those are some of the groups that I would really like to see employers encourage to go get testing. We're working with the state to try and identify procedures where we can also make that easy for businesses that might not be able to release staff to do that. I know some other counties are, working with entities to do their own, the company doing the facility doing their specimen collection, and then we submit it through the state testing site. So we'll see. I mean, those are the key entities. But as you alluded to, in retail, in restaurants, and there's other types of settings where all of us are out regularly, and the workers in those businesses have contact with the public, even though they will be masking, and individuals who have contact with the public in their employment should be masking, and all of us should going in. But it's a tool for us, and so it started with the critical infrastructure workers and healthcare workforce as priorities, but it's open to symptomatic individuals as well, and other workforce could participate too.
Okay, thank you. And kind of a follow-up question for you too. How frequently should people be tested?
I guess if they have the same ongoing kind of risk, that's just the type of work that they do, probably, I would say about every 2 weeks. We don't really have a standard yet, but that's kind of what I've heard others, and it makes sense to me, about it every 2 weeks or so. If a certain, high risk exposure happened, or maybe our numbers were up and that particular setting has some concern about exposure, that might be different, but on a routine basis, about every 2 weeks.
I've got one more restaurant question. I've got one more restaurant question. I won't say if, I'll say when they're allowed to reopen. What's the situation with alcohol? Will they be allowed to serve alcohol?
Yeah, I have not seen any state guidance for restaurants that prohibits alcohol, if that's part of what they're normally licensed to serve.
Thank you.
I hope you can hear me because I have a bad connection today. But I have a question regarding the restaurants. Was that a mistake last week? We published it on our site saying that there could be some dine-in ability if they had met the requirement And the conversation at the Board of Supervisors meeting was more about if alcohol could be served, and it was suggested they wait. So was that a mistake? Did we go forward when we shouldn't have? And now should it go back to just pick up and delivery?
So I think that's an important question. Thank you. So I think that because in Shasta County, we have been working towards being prepared to open up when the opportunity came along. We've been doing a lot of work to get ready. And so I think that we're in a position where we're starting to pull all of our documentation together quickly. And what the governor rolled out last week in terms of allowing regional variation with this attestation was, it happened pretty fast. And so I think that there is a need to get procedures clearly outlined and how that works in terms of communication to and submission from from the county to the state health department, and then how that final communication happens with the governor's office. And I have a sense that some of that hasn't really been solidified yet. And so I think there just hadn't been communication to some of those regulatory agencies, to ABC. And so when we heard about that on Friday, we were kind of surprised too, but I'm not, at this point, I'm really not surprised because, things are moving fast. And so my hope is that will be cleared up and that will be built into the procedures that happens at the state level when they give us our approval. And we will be clear on that. And we do not want to jeopardize our restaurants. And so we will be sure of that before we, let the community know that there's a green light.
So in other words, all those restaurants opened over the weekend for dine-in ability, they should go back and close again, except for the pickup and delivery.
I'm not sure that many restaurants dine-in that weren't actually already doing takeout. I don't know that a lot opened up over the weekend. And certainly, though, you are correct if that's the case, and they are a takeout restaurant or a restaurant that serves alcohol, then yeah, they should hold off. But I would be surprised that a restaurant would be able to get up and going that quickly. But we would recommend that restaurants for dine-in, they need to wait. They need to wait until we say we've had our variants approved.
If I could add one more thing to that, this is Matt Pontus. We definitely message back out that we probably should be waiting, but I can assure you that we've got about 10 different conversations and fronts working with the state to try and open those things up and to try and make sure that that those lines of communication are open. What we don't want to do is to have somebody get a fine through ABC or something like that because with the communications between the agencies were not clear. So we have one of our board members is actively going through our California Association of Counties group and actively making sure that we increase the communication there with the governor's office directly. We have another part of our team working with OES. Our Shasta County OES is working with state OES to make sure that all the right approvals are in the right place. And we also have our public health and Dr. Ramstrom's teams working with the state public health folks to make sure that everybody's on the same page and that we're all moving the ball forward as fast as we possibly can. So I just want to make sure that everybody knows there's a lot of things happening to make sure that happens as quickly as possible.
And I have one more follow-up question regarding the rodeo. Dr. Ramstrom, you mentioned at the beginning of this meeting about maybe a recommendation for the people who attended the rodeo to be tested. That would be like 2,000 people. And also, I noticed the sheriff over the weekend said something about that his idea was about education, and he was assured there'd be no food served. And in fact, there were food trucks, there was no social distancing, there were virtually no masks. So, so now we have 2,000 people who attended a rodeo in Cottonwood. So how do you educate people who some of whom don't even believe, put that in quotes, believe in the COVID-19 virus? And how do you encourage them to be tested if they?
So certainly testing is voluntary, and it's just a recommendation. It's a suggestion. And, you know, people who have concerned, you know, they're the ones who are going to hear that message and might take advantage of it. And other people won't. I would encourage people who attended to make sure that they are staying away from vulnerable groups, even family members, you know, grandparents, older adults, people at home who have underlying health conditions. You should be either staying away or masking around those individuals for 2 weeks. And certainly if you develop symptoms, then you would want to be evaluated and tested.
Other questions? Okay, hearing none. Thank you.
So Carrie, let me just add one additional point to what I just made. I would also say that if anybody attended that rodeo and you work in a high-risk setting, such as a health facility or a skilled nursing facility or a group home that serves vulnerable populations, I would suggest that you either stay home or make sure that you let your employer know. And I would encourage masking and staying away from those vulnerable individuals in your workplace.
All right, thank you, Karen. Are there any other questions? Okay, thank you again for joining us on such short notice. We appreciate it. We will keep you updated as more news becomes available. And we will be back on Wednesday morning at 11 a.m. for our next regular media briefing. Thanks very much, and everyone have a great day.